Hello! Today we're going to be discussing the kidney anatomy as part of our urinary system. So we talked previously about where the kidneys are here in the abdominal cavity, way there in the back. When you look at its position, you notice that on top of it are these two glands. Those are called the adrenal glands, part of the endocrine system. Also note that it kind of has this tough outer surface, this fibrous layer. That's called the renal capsule. This indent that we see right there, the kidneys are not a perfect oval, it has that little indentation there. That is called the renal hilum. This is where the renal artery plugs in and the renal vein and ureters are coming out of. So that's the renal hilum there. If you notice when we go into the kidney though, it's made up of a series of different levels. It's not just one uniform tissue all throughout. So let's zoom in a little bit on this kidney. Again, this outer tough fibrous layer is called the renal capsule. Then we have this layer here. This is the renal cortex. And then we have this dark tissue here, which is the renal medulla or medullary tissue. Now, each little bit of medullary tissue is called a renal pyramid. Note the little triangle, the base and the tip. Those are the pyramids. Notice also that at some point, some of this cortical tissue, the cortex, goes in between the pyramids. That place that goes in between, that's called a renal column. So we have column, pyramid, column, pyramid, column, pyramid as we go through. But the tissue type is the cortex and the medulla. Now here in the middle, this hollow opening here is called the renal pelvis. As we form urine in the cortex and medulla all through here, the urine then goes into this pelvis. These little stabby or spiky narrow parts are called the calyx, the major and minor calyx or calyces. And as the urine then flows into this renal pelvis, note here, there's the ureter. So when we start to collect the newly formed urine here, it now drains out that ureter and we're right back to the gross anatomy we've talked about before, draining into the bladder. So again, as a recap, outer layer is called the renal capsule. This layer, renal cortex, renal medulla. Parts of the cortex that go in between are called the columns. These are called the pyramids. Innermost area here, renal pelvis, going into the ureter. This indented area is the hilum. And then on top here we have the adrenal glands.